Hello everyone, I'm Leilu, and it's great pleasure to present our project Embrace here. And the project is fully titled as Enhanced Maternal and Baby Results with AI-Supported Care and Empowerment. The project has very ambitious expectations. It aims to transform pregnancy healthcare through AI innovation, improve health outcomes for mothers and babies, and create sustainable and scalable healthcare solutions, and finally, build a healthier future for generations to come. Next, I will briefly cover background of our Embrace project and two different phases, and also the steps of how we will implement the project. And we know that every year there are over 200 million pregnancies worldwide, but one-third of pregnant women they may suffer from short and long-term impacts on their health from pregnancy. For example, gestational diabetes would significantly increase their baby's risk of developing type 2 diabetes and other complications later in life. And also, we know that many health those issues can be reduced or prevented entirely by appropriate lifestyle interventions. For example, the World Health Organization recommend using physical activities to reduce complications during pregnancy. However, there are limited evidence on developing scalable, personalized, and healthy lifestyle interventions for maternal and child outcomes in pregnant women. For example, previous research mostly relies on self-reported questionnaires or using other fitness trackers for monitoring their physical activities. And also, there are many studies they develop these trials largely in person and often in healthy facilities rather than considering the complexity of real life conditions. So this project assumes that using a multi-component project would help to develop fast-track major scientific breakthrough and realize maternal and early childhood health through personalized intervention with cutting-edge AI technologies. And we hypothesize that current recommendation for physical activity and exercise are largely unmet, and health outcomes can be improved through recommended physical activity and exercise levels tailored for each pregnant woman. And also, multimodal digital data would provide a comprehensive view of each pregnant woman's unique health profile. So in the first phase, we will establish world's largest digital and clinic phenotype birth cohorts. So they will include 20,000 pregnant women, up to 20,000 have their partners, and also 20,000 babies. So we will use wearables, smartphones, and also to monitor the health, and also we will include clinic visit records. And this study will be implemented across 6 countries, including UK, Spain, Peru, Ghana, China, and Canada, and with the UK as a main site. And so this will be very important to validate our model across different countries to reduce the bias of the predictive modeling and also help us to generalize model for different population cohorts. And yet, in the second phase, we will test a blended human AI intervention. For example, we will develop clinical trials in the UK to evaluate the impact of those interventions on key health outcomes for mothers and babies over their first 1,000 days of life and beyond. And this picture shows some overall structure of this project. So those blue colors, you can see we measure the physical activity, the sleep quality, and also the diet of pregnant women. And then they will provide structure and holistic information of the health conditions of pregnant women. And then those information will be used to for this motivation, behavior activation, and also cognitive flexibility investigation. And of course, we will also involve partners in the study because we know that partners provide very important social engagement during the life course of pregnancy. And an important concept is health coaching. We will have the online exercise, monitoring, and engagement during the whole journey during this pregnancy. And this project aims to reduce the gestational diabetes by 40% during pregnancy. And we know that women who experience diabetes during pregnancy are around 10 times more likely to develop type 2 diabetes later in life, and also to reduce hypertension by 40% during pregnancy, and also reduce depression by 25% during pregnancy, because we know that children or mothers uh, who with prenatal depression also face 2 and 3 times higher risk of developing other complicated mental disorders during the later age. And the core component in this project is consumer technology. So here would be smartwatch. And so we know that modern wearables can track various biomarkers, for example, heart rate, exercise types, and sleep data, and also uh, other data, for example, skin temperatures and more. Those data provide precise and personalized health insights, and with this technology support, we can create world's first human AI health assistant to benefit humanity, starting from the early stage of the life. And this is a timeline of steps of the project. We will first conduct literature review and identify key players in this area and see how our project will fit in this broader ecosystem. And then we will develop a conceptual framework and also obtain the government regulation of using AI for healthcare. And then we will develop a detailed protocol, and then we will first develop the pilot study to test key components, conduct small-scale studies, and to learn lessons from the pregnant women, general public, and also clinicians, and then refine our study. And then we will develop the full-scale study across 6 countries. And even if this is a very large project, and then we're still considering long-term funding because the project will last for 6 years, and then we will use external fundings um, to support this long-term growing of this project, train the team members, and develop ongoing relationship with our stakeholders. And of course, we will have publications and also see if we can improve also develop new policy guidelines and also have community engagement. This is very important for us. And so currently we are in the preparing stage for the Embrace project. We learned the clinic guideline, standard of care for normal pregnancy, gestational diabetes, hypertension, and also depression. And also, we identify factors during pregnancy, for example, nutrition, weight gain, physical activity, and sleep. And we see that Embrace is an impression of this new area of population health research, and it is an important turning point for us to see how we can improve the pregnancy health care, but also we would say how AI technology and also human touch and also other digital health to improve healthcare. Thank you.